I am Adrianna Vlachos. I am a pediatric hematologist-oncologist and Division Chief of Hematology at Johns Hopkins All Children's Cancer and Blood Disorders Institute. I'm also the Director of the Bone Marrow Failure Program and the Director of the Diamond Blackfan Anemia Registry of North America. Diamond Blackfan Anemia syndrome was named after the two doctors that found it, Dr. Diamond and Dr. Blackfan. The patients become severely anemic during their first year of life, and over 50% of them will happen before 6 months of age. Patients become very severely anemic and need a blood transfusion right away. And the reason is, when we look at their bone marrow, where the factory where everything is being made, that they're not making red cells at all. And obviously we can't live without red cells. And so these patients are anemic, they need blood transfusions, and they really need blood transfusions for life if they don't respond to the steroids. Over the last 50, 60 years, we do know that steroids work to treat the anemia and help the patient make red cells again. And so we keep them on transfusion therapy till about 1 year of age. So every 3 to 4 weeks they have to come in for a blood transfusion. And then by 1 year of age we try steroids, and if it works, then they have to live on steroids, prednisone, for the rest of their lives. We have a registry, which is what I've headed for the last 30 years. Of all the patients in the United States, we try to capture as many as we can that have Diamond Blackfan Anemia syndrome, put them on the registry. We now have about 850 patients on the registry. But this is so rare that there's only 7 per million live births in the United States every year, which is about 30 patients a year out of the 4 million patients that are born every year that have Diamond Blackfan Anemia. So it's extremely rare. For patients on steroids, they have to take steroids every day, but they also can live a very long life. But my oldest patient now is 75 years old. So we have patients that are much older because we've moved that needle over the last 30 years to really having patients live well into adulthood. Thank you for your time listening today.